So diverticulitis or diverticular disease is an incredibly common condition. In colonic diverticular disease, what we're referring to are little tiny outpouchings that occur on the colon. So if you actually look at the bowel, it looks like there's little bubble wrap on the bowel. It's a common condition. So if you look at the Sydney population, 60% of the population at the age of 60 have the illness. So these little pockets. Of that 60%, about 1 in 5 people at one stage will develop an issue with the diverticular disease, either bleeding or infection. With regards to diverticulitis, that refers to an infection of these diverticulum or inflammation of these diverticulum. Patients usually will have abdominal pain, discomfort over the abdominal wall, fever, temperature, or a change in bowel habit. Usually the diverticular disease or diverticulitis is confirmed on a CT scan, but also can be confirmed at a colonoscopy. And then in the case of diverticulitis, because there's an infection of the bowel, our treatment involves antibiotics, anti-inflammatories, pain relief, but we also alter your diet by lowering the fibre content. That changes the amount of fibre or material going past these diverticulum, which we can help as you recover from the diverticulitis. With regards to the surgical treatment of diverticular disease, this is less common. We know that less than 10% of patients would need to have any type of surgical intervention. With regards to that, if patients have recurrent diverticulitis, so they're constantly getting infections or they're constantly in and out of hospital because of flare-ups, they can't come off antibiotics, or they develop an issue with the bowel narrows, or it just has this chronic abscess, those patients may need a resection. In that, we use a keyhole assisted technique, which is laparoscopic or keyhole assisted, where we remove that section of the bowel. All patients, if they're having that recurrent diverticulitis, at least need a discussion about what are the options available, because surgery for diverticulitis has come a far way, especially over the last few years.